So this is my follow-up video on ipamorelin, and I did not realize it's already been 2 months since I made that last one. So apologies for not getting back at a more expeditious rate. So per the previous video, ipamorelin is a growth hormone secretagogue. It's a growth hormone releasing peptide, and it works primarily through the ghrelin pathway. One of the principal side effects that it can cause are transient, and I say transient, increases in prolactin and cortisol and aldosterone. Now, when I say transient, I'm talking about if it happens, it'll be within usually the first few weeks, like first 2-3 weeks, and then it tends to abate after that. Actually, very rarely do I actually see people have these excursions in their hormones. The biggest one that most people would be most likely concerned about if it were to occur would be prolactin, as prolactin can have some implications in affecting one's sexual performance. The other possible side effect is water retention. My guess is most likely that's secondary to aldosterone's reuptake of water and sodium. But what that can do is it could compress on your distal areas of your body, namely the wrist. It could compress on that, and it could compress on the medial nerve, which would sometimes give people what they like to refer to as the sensation of having a carpal tunnel-like syndrome. Furthermore, if you have some fluid retention, that can be identified as pre-tibial edema. In other words, right kind of like if you're wearing low-cut socks, right where the sock line is on the front of the leg, on the shin, you compress, you may have a little pitting edema. I don't see that too often. I very rarely ever have patients complain about it, but once again, that is a possible side effect. The biggest pro that patients report to me is decreased sleep latency and enhanced sleep maintenance. In other words, you fall asleep quicker and you stay asleep much deeper. This happens because growth hormone has its effects on inducing deeper stages of 3 and 4 sleep. In other words, you actually hit that deep sleep phase better and you hit it much longer. Another positive that a lot of patients report to me is enhanced recovery, especially in recovery from training. Many of the folks tell me that they feel like they can train more intensely, with longer durations, more vigorously, and they still feel like they don't get sore and they don't need as much downtime between training sessions, and they still feel like they're getting more out of their training due to the fact that they're recovering at a more expeditious rate. So how is ipamorelin administered? The primary method of administration is subcutaneous injection administered in the abdominal fat via an insulin needle. Some compound pharmacies also make the sublingual troches. Those are like wax squares that you dissolve underneath your tongue. However, I don't see people doing as well on those. I do have some patients that prefer them, and they say they tolerate it well, and they feel great on it, and they're getting all the positive benefits of ipamorelin. But the primary delivery that I see, I'd say easily 95% of the patients, are subcutaneous injection. In regards to dosing, we administer right before we go to bed, preferably on an empty stomach. And when I say an empty stomach, I mean at least 90 minutes since you've had your last meal. The reason we say 90 minutes is not because it's an arbitrary number or anything like that, but because gastric emptying for an otherwise healthy person typically takes about 90 minutes.